Your legs and feet might be screaming warnings about your heart that you're completely missing. Right now, over 6 million Americans are living with congestive heart failure. Yet many had no idea their swollen ankles or cold feet were desperate distress signals from a failing heart. Here's the shocking truth. Heart failure doesn't always announce itself with chest pain. Instead, it whispers through symptoms that most people dismiss as aging, being overweight, or simply standing too long. That persistent ankle swelling you blame on your shoes. The numbness in your feet you attribute to sitting too long. These could be your heart's final attempts to get your attention before it's too late. Welcome to our channel. If you're new here, we're thrilled to have you join our community dedicated to transforming health through knowledge. Don't forget to hit that subscribe button and ring the notification bell so you never miss life-changing content like this. We'd love to connect with viewers from around the world. Drop a comment letting us know which country you're watching from. Your journey to better health starts with understanding these critical warning signs. Today, we're exposing 12 scientifically proven symptoms that appear specifically in your legs and feet when heart failure begins. These aren't random inconveniences, they're your body's emergency alert system. Medical research has conclusively linked each of these symptoms to the progressive failure of your heart's pumping ability, and recognizing them early could be the difference between life and death. Now, let's dive into the warning signs of congestive heart failure, beginning with number 1. Cold feet. Most people laugh off cold feet as just having poor circulation or needing warmer socks. But when your heart begins to fail, it faces an impossible choice: where to send the limited amount of blood it can effectively pump. Your body's survival instinct kicks in, prioritizing blood flow to your most vital organs: your brain, heart, lungs, and kidneys. This means that your extremities, particularly your feet, get relegated to the bottom of the priority list. Research published in Circulation documented this phenomenon extensively. The study revealed that patients with reduced cardiac output consistently reported cold extremities as one of their most noticeable symptoms. What's particularly striking is that this coldness often affects the feet more than the hands, because the feet are furthest from the heart and require the most effort to maintain adequate circulation. Unlike normal cold feet that warm up when you move around, heart failure-related cold feet remain consistently cool regardless of external factors. Patients often describe their feet feeling ice cold even when wearing warm socks and shoes, or when the rest of their body feels comfortable. Next, symptom 2. Pitting edema. If you've noticed swelling in your legs or ankles, try this simple test that doctors use. Press your finger firmly into the swollen area for about 10 seconds, then release. If you see a deep indentation or pit that remains for several seconds, you're looking at pitting edema, and this changes everything. Pitting edema isn't just regular swelling, it's a specific type of fluid accumulation that tells a very particular story about what's happening inside your body. Research published in the American Heart Journal has established a direct connection between pitting edema and right-sided heart failure. When the right side of your heart begins to fail, it loses its ability to effectively pump blood that's returning from your body back to your lungs for oxygenation. This creates a backup system where blood pools in your venous system, and the increased pressure forces fluid out of your blood vessels and into your tissues. The indentation you see is literally the displacement of accumulated fluid, and the fact that it doesn't immediately return to its normal shape reveals just how saturated your tissues have become. Next, symptom 3. Muscle weakness in legs. Recent groundbreaking research published in Circulation. Heart failure has revealed that patients with chronic heart failure frequently experience skeletal muscle weakness that limits physical function. This isn't just about feeling tired. This is a fundamental change in your muscles' ability to contract and perform. When your heart can't pump blood effectively, your leg muscles don't receive adequate oxygen and nutrients. The research shows that heart failure patients exhibit reduced myosin heavy chain protein content in single muscle fibers, which manifests as a reduction in functional muscle contractions. This selective loss of muscle protein specifically affects your ability to climb stairs, walk distances, or perform activities that require leg strength. The study found that patients with more severe heart failure had the weakest leg muscles and experienced greater muscle weakness after minimal exertion. This muscle weakness persists even when cardiac function is improved through treatment, indicating permanent changes to the muscle structure. Next, symptom 4, weight gain from fluid retention in lower body. You step on your scale and discover you've gained several pounds seemingly overnight, or perhaps 5 to 10 pounds over just a few days. When this weight gain is accompanied by swelling in your legs and feet, you're not looking at fat accumulation. You're witnessing your body's desperate attempt to cope with a failing heart. The Mayo Clinic proceedings identified rapid weight gain from fluid retention as a key red flag that demands immediate medical attention. This isn't just about numbers on a scale. This weight gain represents a fundamental breakdown in your body's ability to maintain proper fluid balance. Unlike gradual weight gain from increased food intake, fluid retention can cause dramatic weight increases in remarkably short periods. Some patients report gaining 10 to 15 pounds in a single week, all from retained fluid. The weight tends to concentrate in your lower body due to gravity, making your pants tight around the calves and your shoes no longer fit properly. Next, symptom 5, dusky or blue legs. When you look down at your legs and notice they've taken on an unsettling bluish or dusky appearance, this represents cyanosis, one of the most visually striking and medically significant signs that your heart is struggling to maintain adequate circulation throughout your body. Research published in ESC Heart Failure documented cyanosis as a critical peripheral manifestation of congestive heart failure. Cyanosis occurs when oxygen-poor blood begins to dominate your circulation, particularly in areas where blood tends to pool or move more slowly. The bluish tint appears first in the most dependent parts of your body, your lower legs, ankles, and feet. As heart failure progresses, this discoloration becomes more pronounced and persistent. The bluish tint may spread from your toes and feet up your lower legs, and it often becomes more noticeable when you're sitting or standing for extended periods. This color change reveals the desperate state of your circulation and the profound impact on tissue oxygenation. Next, symptom 6, swollen ankles. Swollen ankles represent one of the most visible and earliest warning signs of congestive heart failure. When your heart begins to weaken, it can't pump blood efficiently throughout your circulatory system. This creates increased pressure in your veins as blood backs up from the weakened heart. Research published in JCC Heart Failure confirmed that ankle swelling is not only one of the most reported early signs of heart failure, but it's also one of the most reliable predictors of the condition's progression. As this backed up blood creates increased pressure in your veins, fluid begins to leak out of your blood vessels and into the surrounding tissues. Your ankles become the collection point for this excess fluid because gravity naturally pulls it downward. What makes this symptom particularly concerning is how it typically doesn't go away with rest or elevation. It persists, gradually worsens, and often becomes more noticeable as the day progresses. Next, symptom 7, slow healing sores on legs or feet. When you develop a small cut, scrape, or sore on your leg or foot that should normally heal within days, but instead lingers week after week, this reveals a critical problem with circulation and oxygen delivery that stems from your failing heart. The Journal of the American Medical Association published research highlighting the connection between impaired wound healing and congestive heart failure. The study demonstrated that heart failure patients experience significantly delayed wound healing due to tissue hypoxia, reduced immune function, and compromised circulation. When your heart can't pump blood effectively, your tissues suffer from chronic oxygen deprivation. Wound healing is an incredibly oxygen-demanding process that requires robust blood flow to deliver nutrients, immune cells, and building materials to the injury site. When heart failure compromises this blood flow, even minor wounds become major problems that may take months to close, and some may never heal completely. Next, symptom 8, leg cramps or pain. While walking, after just a few minutes of walking, your leg muscles begin to cramp and ache with an intensity that forces you to stop and rest. This symptom, called claudication, represents one of the most functionally limiting symptoms of congestive heart failure. The Journal of Cardiac Failure published research demonstrating the direct link between claudication symptoms and reduced cardiac output in heart failure patients. When your heart begins to fail, it can't pump blood efficiently enough to meet your body's demands during physical activity. Your leg muscles, being some of the largest and most active muscles in your body, quickly feel the effects of this reduced blood flow and oxygen delivery. As heart function declines, patients consistently report experiencing muscle pain, cramping, and fatigue in their legs during activities that were previously effortless. Initially, you might notice muscle fatigue only during strenuous activities, but as heart failure progresses, these symptoms begin to occur with increasingly mild activities. Next, symptom 9, restless legs at night. You settle into bed hoping for rest, but your legs begin to feel like they have a mind of their own, twitching, cramping, and filled with an indescribable urge to move. Research published in Sleep Medicine Reviews revealed the connection between this fluid redistribution and the development of restless leg symptoms in heart failure patients. During the day, as you stand and walk, fluid from your compromised circulation tends to accumulate in your lower legs and feet due to gravity. When you finally lie down at night, this accumulated fluid begins to shift and redistribute throughout your body. As the excess fluid moves from your legs back toward your core circulation, it can compress nerves, alter electrolyte balances, and create sensations that your brain interprets as an urgent need to move your legs. This nighttime fluid shift creates nerve compression, leading to tingling, burning, or crawling sensations. The compromised circulation associated with heart failure means that your leg tissues may already be struggling with adequate oxygen delivery, and the nighttime fluid shift can exacerbate this problem. Next, symptom 10, varicose veins. Worsening. When existing varicose veins suddenly worsen or new ones appear rapidly, your body might be revealing a much more serious underlying problem. Research published in the Vascular Medicine Journal revealed a significant connection between heart failure and the rapid progression of varicose veins. Varicose veins develop when the one-way valves in your leg veins become weakened or damaged, allowing blood to flow backward and pool in your lower extremities. When congestive heart failure enters the picture, this already compromised system faces an additional overwhelming challenge. When your heart begins to fail, it creates increased pressure throughout your venous system as blood backs up from the weakened heart. This elevated pressure puts enormous stress on your leg veins and their already compromised valves, causing them to fail more rapidly and completely. Patients with previously mild varicose veins often report that their condition deteriorates dramatically over just a few months when heart failure develops. Next, symptom 11, skin changes. When you look at the skin on your lower legs and feet, does it appear unusually shiny, almost like it's been stretched tight? Does it feel different to the touch, perhaps thinner, more fragile, or strangely smooth? These are profound changes that reveal how fluid retention from heart failure is literally transforming your skin. Research published in Heart and Lung documented these characteristic skin changes extensively in chronic heart failure patients. When congestive heart failure causes fluid to accumulate in your tissues, it doesn't just create swelling, it fundamentally alters the structure and appearance of your skin. The excess fluid stretches your skin beyond its normal capacity. The shininess you might observe occurs because normal skin has a matte appearance due to its natural texture. But when fluid accumulation stretches the skin taut, it flattens these natural features, creating a smooth, shiny surface that reflects light differently. This change is so characteristic that healthcare providers often use it as a visual diagnostic clue for fluid retention. Next, symptom 12, numbness or tingling in the feet. The unsettling sensation of your feet falling asleep becomes a constant companion throughout your day. Research published in Current Heart Failure Reports revealed the significant prevalence of these neurological symptoms in heart failure patients. Numbness and tingling in the feet related to congestive heart failure can occur through two primary mechanisms. The first involves direct nerve compression from tissue swelling. As fluid accumulates in your feet and lower legs due to poor heart function, this swelling can compress the small nerves that provide sensation to your feet, creating numbness, tingling, or even shooting pains. The second mechanism involves reduced oxygen supply to the nerves themselves. Your peripheral nerves require adequate oxygen to function properly. When heart failure reduces blood flow to your extremities, the nerves in your feet may not receive enough oxygen to maintain normal function. This oxygen deprivation can cause the nerves to misfire, sending false signals to your brain that you interpret as numbness or tingling. Initially, you might experience mild tingling that comes and goes, But as heart failure progresses, these sensations can become constant and more intense. Some patients report feeling like they're walking on pins and needles, while others describe their feet as feeling completely numb. As we've explored these 12 critical symptoms, one thing becomes crystal clear. Your legs and feet are sophisticated early warning systems that can detect heart failure before it becomes life-threatening. Every symptom we've discussed represents your body's desperate attempt to communicate that your heart needs immediate attention. The research is unambiguous. These symptoms aren't minor inconveniences to be dismissed. They're evidence-based indicators of a condition that affects millions and continues to claim more lives than many forms of cancer combined. But recognizing these symptoms early can be the difference between a manageable condition and a medical emergency. Remember, congestive heart failure doesn't always announce itself with dramatic chest pains. More often, it whispers its presence through the subtle changes we've explored today. That persistent swelling that doesn't go away with rest, the cold feet that no amount of warm socks can fix, the mysterious weight gain that seems to appear overnight. These are all your body's way of asking for help. If you recognize multiple symptoms from today's discussion, don't wait for them to worsen or hope they'll resolve on their own. Contact your healthcare provider immediately. Early intervention in heart failure can dramatically improve outcomes, quality of life, and longevity. If this video was helpful in opening your eyes to these critical warning signs, kindly type helpful in the comments. That truly motivates us to continue producing life-saving content like this. Please hit that like button if you found this information valuable, share it with anyone who needs to see this, and don't forget to subscribe for more health insights that could change your life. Thank you for taking the time to learn about these crucial symptoms, and remember, recognizing these signs early could be the most important thing you do for your future.